If you're facing surgery for arthritis in your big toe joint, you have two main options, and choosing the wrong one can affect you for the rest of your life. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. After helping thousands of patients navigate this exact decision, I've learned that understanding the differences between implant and fusion surgery is crucial for making the right choice. What most people don't realize is that your age, activity level, and specific type of arthritis all play a role in determining which procedure is best for you. In today's video, I'm going to break down exactly how each surgery works, who's a good candidate for each procedure, and the key factors you need to consider before making this important decision. You'll learn about recovery times, long-term outcomes, and most importantly, how to work with your surgeon to choose the option that's right for your lifestyle. Before we get started, please take a moment to hit the like button, subscribe to the channel with the notification bell, and this helps others find the information they need, especially if they're suffering from great toe joint arthritis. When arthritis in your big toe becomes severe enough to require surgery, you're typically looking at two main options: joint fusion or joint replacement with an implant. Both procedures can provide excellent pain relief, but they work in completely different ways and are suited for different types of patients. Understanding the difference between these procedures is crucial because the decision will affect how you walk, what activities you can do, and how your foot functions for the rest of your life. Unlike some surgical decisions that can be revised later, choosing between fusion and implant is largely irreversible. The condition that typically leads to this decision is called Hallux rigidus, which is literally meaning stiff big toe. This is arthritis of the big toe joint where the cartilage has worn away, causing bone-on-bone contact. The result is pain, stiffness, and often bone spurs that make it difficult to bend the toe upward. Joint fusion, also called arthritis, involves removing the damaged cartilage and fusing the two bones of the big toe joint together permanently. Think of it like welding two pieces of metal together. Once healed, the joint becomes one solid piece of bone that doesn't move. The fusion procedure begins with removing all the damaged cartilage and any bone spurs from both sides of the joint. The surgeon then shapes the bone surface so it fits together properly and secure them with screws, plates, or pins. Over the next 6 to 8 weeks, the bones grow together to form one continuous bone. The biggest advantage of fusion is pain relief. Once the bones are fused together, there's no more painful bone-on-bone contact. The joint can't move, so it can't hurt. For patients whose primary goal is to eliminate pain, fusion is often the most reliable option. Fusion also tends to be durable. Once the bones are fused, the repair typically lasts for life. Since there's no implant to wear away or break, the revision surgery is rarely needed. It makes fusion particularly attractive for younger, more active patients who want a long-term solution. However, fusion comes with trade-offs. The most obvious is the complete loss of motion at the big toe joint. This affects how you can walk and can limit certain activities. You won't be able to wear high heels effectively, and activities that require significant toe bending like yoga or ballet may be difficult. The loss of motion often also changes how forces are distributed across your foot. This could potentially lead to problems in the adjacent joints over this time. Though this doesn't happen to everyone, it may take years to develop. Joint replacement with an implant takes a different approach. Instead of eliminating the joint, the surgeon replaces the damaged joint surface with artificial components. Modern big toe implants are typically made of titanium or other biocompatible metals. Some implants are made of a silicone-like polymer that simulates cartilage in the joint. The implant procedure involves removing the damaged cartilage and reshaping the bone surfaces to accept the implant components. One part of the implant is inserted into the metatarsal bone, while the other component replaces the damaged surface of the toe bone. These components are designed to glide smoothly against each other, restoring pain-free motion. The primary advantage of implant surgery is preservation of motion. A successful implant allows you to maintain much of your natural toe movement, which means a more normal walking pattern and the ability to participate in activities that require toe flexibility. Implants also tend to have faster initial recovery. While fusion requires 6 to 8 weeks of limited weight bearing to allow the bones to grow together, Implant patients can often begin walking normally within a few weeks. However, implants have their own set of considerations. Like any mechanical device, implants can wear out over time. While modern implants are much more durable than earlier versions, they may be eventually still need to be replaced, and especially in younger, more active patients. Implant surgery also has a slightly higher risk of complications, including infection, implant loosening, or implant failure. If an implant fails, revision surgery is more complex than the original procedure and may ultimately require conversion to a fusion. So, how do you decide which option is right for you? Several factors play into this decision, and it's important to discuss all of them with your surgeon. Age is a significant consideration. Younger patients, particularly those under 60, often benefit more from fusion because of its durability. Since implants may need replacement over time, a younger patient may face multiple revision surgeries throughout their lifetime. Older patients, particularly those over 65, may be better candidates for implants. They're less likely to outlive the implant, and the preservation of the motion can be particularly important for maintaining the mobility and independence as they age. Activity level is another crucial factor. High-impact athletes or people with physically demanding jobs do better with fusions because of durability and reliability. The loss of motion is often less important than having a joint that can withstand high stress without failing. Conversely, patients who prioritize maintaining their current lifestyle and activities may prefer an implant. This is particularly true for people who enjoy activities like dancing, yoga, or wearing fashionable shoes that require toe flexibility. The severity of your arthritis also influences your decision. Patients with severe bone loss or significant deformity may not be a good candidate for implants because there's not enough healthy bone to support the implant components. In these cases, fusion may be the only viable option. Your overall health status matters too. Patients with diabetes, circulation problems, or compromised immune systems may have higher risk with implant surgery. The presence of a foreign body can potentially increase infection risk in these patients. Bone quality is another important consideration. Patients with osteoporosis or poor bone quality may not be a good candidate for implants because the bone may not be strong enough to support the implant components securely. Recovery expectations differ between the two procedures. Fusion requires a longer period of restricted activity while the bones heal together. But once healed, the repair is typically permanent. Implant recovery is often faster initially, but there's always the possibility of future problems requiring additional surgery. Cost considerations may also play a role. While both procedures are typically covered by insurance, implants are generally more expensive initially. However, if an implant needs a revision, the total lifetime cost could be significantly higher than the fusion. It's important to understand that both procedures have high success rates when performed by an experienced surgeon on appropriate candidates. The key is matching the right procedure to the right patient based on their individual circumstances and goals. Some patients worry that choosing fusion means they'll never be able to walk normally again, and while fusion does change your gait slightly, most patients adapt well and can participate in most activities they enjoyed before surgery. The trade-off of losing motion for reliable pain relief is often worthwhile. Similarly, patients considering implants shouldn't assume they're getting their original joint back. While implants preserve motion, the range of motion is typically less than a normal joint, and the feel of the joint is different. The decision between the fusion and implant isn't one you should make quickly. Take time to discuss your goals, lifestyle, and concern with your surgeon. Consider getting a second opinion if you're unsure. This is a decision you'll live with for the rest of your life, so it's worth taking the time to make sure you're choosing the right procedure that is properly chosen for you. Recovery from either procedure requires patience and commitment to following post-operative instructions. The success of your surgery depends not just on the technical aspects of the procedure, but also how well you heal and how closely you follow your rehab program. Long-term follow-up is important with both procedures, but particularly with implants. Regular checkups allow your surgeon to monitor the implant for any signs of wear, loosening, and address problems before they become serious. If you found this information helpful, please share this video on social media. Your simple share can help someone make one of the most important decisions about their foot health. Also, leave a comment below if you have a question about your great toe joint surgery options. I do my best to respond. If you're facing a decision between fusion and implant surgery for your big toe joint arthritis, schedule a consultation to discuss your specific situation. We can review your x-rays, discuss your goals and lifestyle, and help you understand which option might be best for you. The link to the schedule is in the description below. Thanks so much for watching, and have a great day.